My patient was reluctant to question his doctor's approach to Lyme disease, despite gaining a considerable understanding of Lyme disease and its complexities. He had learned that Lyme disease could lead to both acute and chronic illness, requiring careful and sometimes prolonged treatment. He understood that diagnosing Lyme disease could be necessary even if the tests were negative, recognizing the importance of clinical judgment in the diagnostic process. As he delved deeper into his research, he became aware of the potential for co-infections with other pathogens like Babesia and anaplasmosis, which often accompany Lyme disease and complicates its presentation and treatment. He learned that Babesia, a parasite that infects red blood cells, could cause symptoms similar to malaria, such as fever, chills, and fatigue. Anaplasmosis, a bacterial infection, flu-like symptoms, including fever, headaches, and muscle aches. He also knew that there was a risk of developing chronic illness if these infections were not adequately addressed. He was particularly concerned about the possibility of a persistent tick-borne infection, which could continue to cause debilitating symptoms despite initial treatment. Despite this growing knowledge, my patient remained hesitant to question his doctor's approach. His doctor appeared reluctant to consider Lyme disease without a positive test. Consequently, his symptoms persisted and his quality of life continued to decline. He experienced severe fatigue, joint pain, cognitive difficulties, and a general decline in his physical health. His persistent symptoms impacted his ability to work, engage in social activities, and maintain his overall well-being. It wasn't until his condition became unbearable that he decided to seek a second opinion. This decision was driven by his declining health and a realization that his current treatment plan was not addressing his needs. He was diagnosed clinically with chronic manifestations of Lyme disease and a co-infection with Babesia. He was treated with a combination of doxycycline, an antibiotic effective against Lyme disease, followed by a combination of zithromax and malarone, antibiotics and antiparasite medicines tailored to address both Lyme disease and his co-infections. With his treatment, he began to improve, his chronic symptoms gradually diminished, and he started to regain his strength and vitality. His energy increased, his joint pain subsided, and his cognitive function improved, allowing him to return to his normal activities. This experience emphasizing the need for a comprehensive approach that considers potential co-infections and the persistence of symptoms despite initial treatment. It also underscores the necessity of being an advocate for one's own health, even if it means challenging a doctor. My patient's journey demonstrated the value of seeking second opinions and being proactive in the face of chronic illness. By taking control of his health care and pursuing further evaluation and treatment, he was able to find a path to recovery that significantly improved his quality of life.